Welcome, everyone. The first item is a presentation on the personnel budget item in DBM. Jacob, you're on.
Great, thank you, Mr. Chair. For the record, my name is Jacob Cash, and I'll be presenting the fiscal 2027 budget analysis for the Department of Budget and Management, Office of Personnel Services and Benefits. I'll discuss the ongoing status of vacant positions, statewide salary actions, and the state's health plans. Starting on page 1, the allowance is $258.9 million, and most of the funding in fiscal 26 and 27 will be distributed to other agencies because this is funding in the statewide program, and that will support salary increases as well as some other purposes. Moving to the performance evaluation on page 5, Exhibit 1 shows the overall state prescription plan spending. Annual committee narrative requires DBM to submit quarterly reports on medical, dental, and prescription drug costs for state employee health plans. But in fiscal 2025, DBM missed 3 reporting deadlines, leading to the restriction of $100,000 in general funds pending submission of their first 2 fiscal 2026 reports. DBM has since submitted the remaining fiscal 2025 reports and all fiscal 2026 reports on time. However, there were some problems. Recent reports dated from January 1st to September 30th of last year contain prescription drug data issues relating to the change in vendors. The department previously was contracted with CVS Caremark, and now we are contracted with Med Impact Healthcare Systems for the prescription drug vending. The reporting of the top 10 drug costs has changed. Most of the categories have now shifted what formularies are included in each category, and so it's difficult or impossible to compare across the vendor periods. Some of the fiscal 2025 reports also excluded non-top 10 spending categories, which created a gap in comparing the total costs because we didn't have that figure. So in that 6-month period, there's a placeholder estimate for quarters 3 and 4 of 2025. Comparisons of historical data have also been disrupted by changes in how each of the vendors define utilizers of drugs. Despite these reporting issues, the data indicate overall prescription drug costs have leveled off somewhat. There was $142 million in costs in the first quarter of fiscal 2025, and about $146 million in the first quarter of 2026. That first quarter growth was about 3% in fiscal 2026, which was lower than the 12.5% average annual growth seen in the last 3 years. Moving to page 6, Exhibit 2 shows the cost of anti-diabetes medications over time. So this is one of the categories where we're able to compare over the time periods. This category remained mostly consistent. Diabetes medications have been a big driver in healthcare and prescription drug costs in recent years, especially with GLP-1 drugs increasing in utilization and popularity. There was a rule passed last year by DBM to limit how much GLP-1s are covered under the state plan, and that has somewhat reduced costs. Although anti-diabetic drugs remain the largest cost category, other categories have experienced faster growth in recent years, including dermatologicals. That is one of the categories where we're not able to compare the past and current periods. In the previous period, there was an increase of over 160% over 5 years, but only a 3% increase in the number of users. So that indicated that there was a big increase in the actual cost of the drugs and or a shift to name brand products. However, because of the limitations in this data, we're unable to determine what was causing those increases or compare these categories to the current period. DLS is recommending releasing the $100,000 in restricted funds for these reports, but we are recommending to continue that annual committee narrative. And we're requesting that DBM additionally provide information clarifying the reporting differences between the 2 vendors and identify ways that they can improve consistency with prior reporting. On page 6, I'd like to point out a few planned deficiencies in this budget that total $40 million. $30 million is backfilling overstated savings from the Government Modernization Initiative. If you remember, $50 million was budgeted in general fund savings last year, but so far the vendor has not been able to find that amount. So funding is needed to fill the gap in the statewide account. Another notable deficiency is $1.8 million in general funds that were needed to backfill unused CEF special funds that were authorized for the same purpose, but was not used due to billing mistakes. DBM has since stated they would rectify the billing errors moving forward. Exhibit 4 on page 9 shows the spending by purpose that is proposed in the statewide program for the upcoming budget. Funding is provided for a 1.5% general salary increase for state employees, excluding SLEOLA, and then regular increments for SLEOLA only. A Maryland School for the Deaf employees would receive a 2% negotiated salary increase. Funding is also provided for a technical adjustment to salary steps, expanding the width of each step to at least 2% standard, whereas they're currently about 1.8 to 1.9% of a salary increase between each step. There's also annual salary review funding providing about one or two grade level increases for 47 classifications in state government, mostly for Department of State Police and Department of Health employees. Most salary schedules are affected by the width increase, I should mention, excluding the law enforcement. And general funds are also provided for public safety recruitment and retention bonuses, as have been in the past number of years, as well as special funds for electric vehicle purchases. Exhibit 5 on page 10 shows the historical and currently proposed salary increases from fiscal 2019 to 2026. Most state employees have received salary increases and salary step increases equivalent to about 35%. In fiscal 27, the governor's budget provides an additional 1.5% pay raise and salary step expansions, as I just mentioned. Due to the fiscal condition of the state, DLS is recommending deleting that $63.8 million provided for salary step expansions. The first issue I'll discuss is vacancies in state agencies. There's been an increase in state employment over the past 2 years. And this is on page 14. There's been an increase in state employment over the past few years, and the allowance adds 196 positions in fiscal 27 as well, mostly for transportation, and within transportation, mostly for Purple Line. Recommendations were made in several analyses to reduce the number of new positions, so we're not making any overall statewide recommendations here, but simply trying to provide a larger picture view of what's going on with vacancies and recruitment. Exhibit 9 on page 16 shows the vacancies in the executive branch, as well as judicial, legislative, and higher ed. Vacancies peaked at 6,500 in October 22, while they have reduced down to 4,825 in April 25, but there was a slight rebound in fiscal 2025, leading to an overshooting of the fiscal 2026 budget. Deficiencies were needed to fill the gap, as well as the implementation of a partial hiring freeze of non-critical positions. I'll say DLS has found some discrepancies in the vacancy data or vacancy records that we've been provided. Several agencies have found errors compared to their internal records, and so we would recommend interpreting this data with caution. Exhibit 10 on page 17 shows the growth in executive branch positions that are filled. They reached a peak of 47,542 in January of this year. They're currently about 4,350 higher than in January of 2023, when the increase in employment really kicked off. Here we're asking DBM to comment on whether the limited hiring freeze will continue into fiscal 2027, given the state of the budget. Issue number 2 begins on page 19, and this is regarding retiree prescription drug coverage and the transition to Medicare Part D. The state terminated prescription drug coverage for Medicare-eligible retirees effective January 2025, which moved these costs and revenues to the federal government. That move saved about $90.7 million in total funds across fiscal 2025, or about $50 million in general funds, representing half a year of savings and matching what was budgeted in savings. Part of the transition, including the state setting up health reimbursement accounts for out-of-pocket expenses for retirees, and the state has funded about $3 million of those costs with Senior Prescription Drug Assistance Program funds, or SPDAP. We're recommending to reduce general funds in fiscal 27 by $3 million and replacing that with special funds since this funding was not utilized in fiscal 27, but it's available. The third issue I'll discuss is state's health insurance plan, beginning on page 20. Medical premiums for most members increased by 5% for the 5th straight year. Medical costs grew by 10% in fiscal 25, and they're projected to increase again by 9% in fiscal 26 and 7% in fiscal 27. Prescription drug costs increased by 34% in fiscal 25. That decrease is mostly for the Medicare Part D transition, but we're expecting a rebound and increase of 8% in fiscal 26 and 12% in fiscal 27. The $90 million in total fund savings for that Medicare Part D transition is anticipated to roll forward. Here, DLS is asking DBM to comment on factors that are leading to the projected increase in healthcare costs. The final issue I'll be discussing today is the Government Modernization Initiative, beginning on page 22, and then Exhibit 13 on page 23, which actually shows the initiatives and the associated savings. The state contracted with Boston Consulting Group, which will receive 20% of identified savings, up to $15 million in total, if they achieve $75 million in savings by November 2026. The contract is fully funded through federal funds available from the American Rescue Plan Act, and $50 million was budgeted in savings in fiscal 2026. Because that full amount has not yet been identified, $30 million was included in deficiencies, as I mentioned at the outset of this presentation, to offset those reductions. As of January 2026, the vendor has identified approximately $35 million in savings. Largest category involved benchmarking prices for purchased goods and services. By comparing industry and peer state pricing, the state negotiated better prices for items like food services, software licenses, radio services, and office supplies. In some of the cases, agencies were paying different prices for the same goods, prompting standardization of pricing between the agencies or purchasers. And the state's purchasing power was often used or emphasized as a point of leverage in these negotiations. Some of those savings we assumed to be recurring, but it was not identified in the report. And so here we're asking DBM to identify how much of those savings are recurring in terms of the new contracts negotiated. A substantial share of the identified savings comes from changes to the vehicle's fleet. Vehicle fleet, the initiative paused 196 of 538 planned purchases, which generated $8 million in savings by adjusting approvals based on utilization rates. Additionally, the state identified excess vehicles for disposal and began auctioning them off. And about 520 vehicles are estimated to be sold in fiscal 26, or about 5% of the fleet. These sales are expected to generate $2.2 million in one-time revenue and $0.8 million in recurring savings, which is from the avoided maintenance costs. Further savings of $1.3 million were achieved by using predictive analytics to select lowest cost vendors for maintenance. Some of these reforms may produce ongoing savings, but not all recurring impacts have been fully quantified. Additional confirmed savings stem from communications and technology efficiencies. A 2-month validation test identified unused or underused landlines, which led agencies to eliminate about half of them and produce recurring savings of $1.5 million or so. Similarly, about 20% of cell phone lines were found to have minimal use, and they were discontinued, saving $500,000. And the initiative also extended laptop replacement cycles from 3 years to 5 years. For some agencies were at 3 years instead of the standard of 5, and so that resulted in 1.5 in recurring savings. Further savings of 1.5 million were achieved by standardizing laptop specifications across agencies. Here, DLS is asking, or is recommending, committee narrative, requesting a report on the government modernization initiative, detailing which initiatives have been implemented, the savings achieved by those initiatives, and the incentive payments that are being paid to the contractor, including for all of these fund source information and the differentiating between one-time and ongoing savings. Recommended actions for this budget are listed on page 25, and they are summarized on pages 2 to 3, but that concludes my presentation. I'd be happy to answer any questions you have.
Thank you. Are there questions from members of the committee? Going once, going twice? All right, thank you very much. Mr. Secretary? And your merry band?
Thank you, Mr. Vice Chair. Thank you, Mr. Vice Chair, members of the committee, and thank you to Mr. Cash, as always, for his thoughtful analysis. For the record, Jake Weissman, Secretary, Department of Budget and Management. With me today at the table, I have our Deputy Secretary, Mark Nicole, our Chief HR Officer, Neil Desai, and our Director of the Employee and Benefits Division, Christina Kaminsky. I also have in the audience, Jen English, our Deputy HR Director, Elizabeth Sachs, our Director of the Government Modernization Initiative, Raquel Coombs, our Chief of Staff, and Dana Phillips, our Director of Intergovernmental and Legislative Affairs. Sorry? We left a couple people there.
Okay, good, thank you.
I'll go through the responses to the DLS analysis as well as the recommendations, and we're happy to take any questions, of course. Concerning the medical, dental, and prescription drug costs on page 7 of the analysis, we thank DLS for the recommendation to release $100,000 in funds. DBM worked with our new PBM Med Impact, and modified the reporting to more closely align with what was provided by CVS. The revision was finalized and provided for Q1 of FY26 on January 15th of this year. Concerning the DLS recommendation on deleting what we've called the step fix on page 10, DBM respectfully disagrees with this recommendation. In conversations during my short time here, this issue has emerged as a longstanding issue of inequity that exists in our state government and which this administration is determined to address. DBM is committed to continuing to make progress on addressing this disparity between step widths for different salary scales through a phased approach to reach the 2.5% salary step width goal that was set and unanimously agreed to by the state and labor representatives in the 2024 Salary Competitiveness and Pay Equity LMC. We understand the need to identify areas of cost containment, and I appreciate DLS and this committee being fastidious on safeguarding taxpayer funds. I know it's a goal that we all share. However, the state negotiated these increases in good faith with representatives of different bargaining units during the recently completed negotiations. We value our state workforce and feel strongly that this provision should not be modified. Regarding the vacant positions on page 17, at present, the administration continues to the limited hiring freeze into fiscal year 27. Concerning the DLS recommendation on the funding of retiree health reimbursement arrangement on page 20, DBM concurs, and we will include an item in the supplemental budget to bring in the funding from the SPDAP. We would note that the general fund reduction proposed should be made in an agency budget rather than a statewide account, as there is no health insurance funding in the account to be reduced in fiscal year 27. Concerning the increase in state health insurance contributions on page 22, as you're all aware, Maryland, together with every state in the country, is seeing increased healthcare costs and utilizations. We have seen year-over-year increases in the cost of treating patients driven by inflation, high utilization, and new treatments. Specifically, the state has seen increased utilization of outpatient hospital, physician, and emergency room services. In addition, pharmacy costs are being driven by new medications entering the market and a more than 15% increase in the number of prescriptions filled. All of these factors have increased the trend in medical expenses from 6 to 7.5% annually, and the trend in pharmacy costs from 10 to 12% annually. The second factor driving the increase in state agency health insurance costs is the utilization of the prior year fund balance and the annualization of savings from the discontinuance of Medicare-eligible prescription drugs, which offset increases in fiscal year 2026 agency costs. Concerning the questions on the Government Modernization Initiative savings on page 24, DBM concurs with the DLS recommendation on committee narrative, though we would like to clarify the requirements of the report with DLS before the language is finalized. Concerning the DLS recommendations, I'll keep this short. I've addressed DLS recommendations 1 to 2 already. I want to note that DBM concurs with DLS recommendations 3 through 11. And with that, we're happy to take any questions. Thank you, Mr. Chair.
Any questions from members of the committee? Going once? Yes, Senator Corderman.
Thanks, Mr. Chairman, and thank you guys for being here today. Appreciate the presentation and all the information. A couple things real quick to touch on. One, the last thing, the Government Modernization Initiative. I was reading on here. It's something I was unaware of, but I presume because it's in the report that it's accurate. We had a contract with a consulting group or something that would identify savings, and then we would pay them a percentage of what those savings are. That's accurate?
That's correct.
Okay. So just theoretically, if they found $20 million in savings, we're going to pay them 10%, whatever the math is, or 20%, excuse me, we're going to pay them back on that.
Correct.
But it doesn't look like this, that's one issue. But the other issue is it doesn't look like the overall savings that we thought was going to be identified last year actually came to fruition to begin with, right? Because there was a deficiency?
So I can talk. I can talk to that.
Ahead. Sure.
So when we put together last year's budget, we assumed a general fund savings of $50 million for fiscal year 26 from that contract.
Right.
To date, we have not. So what we found so far is we found more savings in non-general fund agencies than we expected. So we've found a lot of savings in the Department of Transportation and other special funded agencies. So we've probably gotten around $50 million of savings. We just haven't gotten them all in general funds. So what we had done last year when we put the budget together, we had assumed those savings were all in general funds. They've come in across other fund sources. Okay. So some of that savings has accrued to, say, the Maryland Insurance Administration, the Maryland Department of Transportation, and other special fund agencies. Department of Natural Resources has some special funds.
Right.
Additionally, one of the reasons for the deficiency is because when we put those budgets together, we have also assumed some reversions and some revenues, and because the way the account was set up, reversions and revenues couldn't be offset against the $50 million savings. So some of that is backfilling for those savings. So we're assuming about $2 million from the sale of vehicles that's showing up on the revenue line, but because we budgeted it as a cost savings, we've got to adjust for that. We're also seeing additional reversions in some of the Do-It programs where we have sort of shared services, where Do-It is going to be reverting $2 to $3 million at the end of the year. So we're not receiving those savings right away, so we have to make the statewide account whole, but we're going to get some money at the end.
How much have we paid back to this consulting group? I guess originally we were identified hopefully $50 million. Obviously, they would have got probably $10 million back. So the net would have been $40 million. Actually, would have been the savings,
right.
Not 50.
So the contract that we set for them had a goal of $75 million in total savings, and was estimated to be could go up to $15 million. So far, we're not there. We'll probably be in the $11-12 million range, but we're continuing to work with them. They're continuing to identify additional savings, and the contract does go on through December 31st, 2026. So some of these savings could actually come as part of the fiscal year 27 budget.
Okay, excellent. Appreciate that. Additional follow-up, Mr. Chairman, if you don't mind. In deference to my friend here to my left, who is the chair of the audit committee, just want to bring up the recent audit reports. There were 6 findings, I think, that were identified. 4 of them repeat findings, and so I don't want to go through each one individually because again, that's something we do in that committee. But we do want to have that conversation, obviously, in this committee because that's where a lot of it comes to. Two of them have to do with in regards to, I guess, obviously pay and things of that nature. One of them's in reference to being able to identify employees when they have left and they're still on the payroll, and we've continued to pay them. So I guess that would be one we can give an update on that as far as what we've done since that audit report to help rectify that situation, so we're not continuing to pay employees once they're no longer on the rolls. The second one has to do with overtime. It looks like a lot of that is with the Department of Corrections, which is very understandable because that's where a lot of overtime is. But there were some examples in there where individuals per se would take leave and then still work 8 hours, but then they would get paid overtime. And so I would just like an update on that too, as far as what we're doing to try to, because that's, respectfully, it's kind of gaming the system to a certain point. And so if you could comment on those two particularly, that would be appreciated.
Yeah, absolutely, sir. And happy to follow back up with you on both of those. Can certainly talk about the, you just raised the paid leave issue, and that is, and noted that in the audit from OLA and looking into it, on paid leave, that is a current state policy that employees are, and it's been negotiated, that employees are able to take paid leave and have that count towards overtime calculations. So while that is state policy, we continue to implement it as such. Obviously, if the policy changes, we will change our behavior as well.
So I'm understanding that's policy, or that's statute, or like is that a policy within the department, or whose policy is that?
I believe that's negotiated with our unions.
Negotiate with the unions that they can, okay. And who does that negotiation again?
DBM in partnership with our.
Okay, so that was your negotiation in partnership with that agent or that bargaining group per se?
Yeah.
Which is leading to that issue that we can repeatedly have had.
Yeah, I mean, I believe the policy's been in effect for quite some time, but I can go back and check that.
Okay, no, I think it would be something to revisit as it continues to become a repeat finding from OLA, excuse me. And so I do appreciate the feedback on that. And then the other incidents where employees are leaving but are continuing to be paid. Any update on any type of internal systems that have been put in place, guardrails, et cetera, to try to mitigate that issue?
Yeah, absolutely. I mean, there's a number of ways in which we can begin to address that. And one is straight up just with the data side of this is we've begun instituting regular reporting and data pullings that we provide to individual agencies to give them more tools with which to police and manage their overtime. We also work with them on overtime policies and making sure that they are adhering to those policies and instituting them where they don't yet currently exist. So we will be instituting a semi-annual certification requirement for agencies to make sure that they are affirmatively working on affirmatively managing towards their overtime policies. And so those are two sort of examples of items that we've instituted already. Okay. I'm sorry. You said overtime policies. I was on that one as well. There's been a similar thing for 6 months, annual certification, semi-annual certification, where we are looking at that they are actively pursuing and managing to mitigate any timesheet errors or elements of that nature. So there's the semi-annual certifications on both the OT and on this issue.
Thank you. I appreciate the update. Thank you, Chairman.
Thank you, Chairman. Thank you for the information. One of the problems that we've seen repeatedly, especially in my subcommittee, is retention and just the vacancy problem that we do have. With the 1.5 COLA, how is that going to help to improve recruitment? Because recruitment is a major issue. The overtime is an issue, but we want to make sure that our workers aren't working doubles every week. That's a safety factor, and we just want to make sure we're ahead of that. So how are we just making sure that we're keeping ahead of that, making it safe for our workers, and finding ways for recruitment?
Appreciate that, Senator. I want to talk about recruitment in a bigger sense. So we talked about corrections briefly before, and one of the things that I'm sure you noticed during DPSCS's budget is they've done a phenomenal job on recruiting, because it is the #1 way to drive down overtime. It is the #1 way to help our employees be safer in that regard. The 1.5% COLA will obviously help keep up with salaries. Unfortunately, we go through the same thing that everyone does, right? How do we balance the needs of the state taking care of our employees and our fiscal restraints. And we felt the 1.5% COLA, as well as the first part of the step fix that I mentioned earlier, as a way to help ensure that we are able to look out for our employees.
Well, I just, I think a priority is, we're here for 90 days. And those 90 days, it's like cramming for a test.
Yeah.
And that's what we're doing. And so we're making sure that before we leave here, this is just one of the things I think are priority, making sure that we have the right people and the amount of people that we need that cover everything. So again, the people don't work a double every day and they're just exhausted. We want the safety is always has been the priority.
Yes.
We want to make sure that the workplace is safe, that they're working in a way that they're cognizant of what they're doing. And if we could do more, let's do that. And I know you've been trying to recruit, and it's not been the most successful thing, but if we could try to retain and recruit, I think it'd be a benefit. And if we can do that, finding different ways. I know it's out there for bonuses, but I think we need to be above that. But I appreciate that.
Truly appreciate the partnership on that,
Thank you, Mr.
Senator.
Other questions? I've got a comment. I just want to pick up on the Government Modernization Initiative, which is something we've talked about. Obviously, it's a new initiative. As the Deputy Secretary indicated, the numbers are a little bit of an accounting issue in terms of where the money was saved, but money saved is money saved. And it shows, I think, that it's working and it's important. I think the fact that you have done a contract with outside consultants who are experts at this, who have looked at other states, have looked at other organizations, I think is very healthy. I just hope that going forward, we're going to see more of this. So I would just encourage you along that line.
Appreciate that, Mr. Vice Chair. And I think everyone here is aware in the governor's budget in the executive office, we are expanding the GMI, including having personnel to work with our partners in labor to find savings that they've identified or other. We are not going to stop. And no, sir, you've led on this effort, but we are not going to stop in trying to find places where we can find savings.
Great. Thanks a lot.
Thank you.
Thank you.
Maybe we'll start with the folks from AFSCME. You want to come up? Do you have enough chairs? I think so. Great, and please go in whatever order you prefer.
Good afternoon. My name is Tony Sines. I'm the president of AFSCME Local 898. We represent correctional officers at prisons in Cumberland, Maryland. Since my colleague John Feely from MCTC in Hagerstown testified before this committee last year, we have lost more pens from the western region. The staffing crisis is getting worse, not better. North Branch Correctional Institution is a supermax facility in my local. Officers right now are being mandated 7 or 8 weeks straight without a day off. In those weeks, they're being forced to work multiple doubles. This facility currently has a vacancy rate over 35%. This facility has 315 pens authorized by DBM, but requires 405 pens to safely be staffed. We are currently has 151 staffing vacancies. At another facility in my local Western Correctional Institution, a maximum security facility, the vacancy rate is over 40%. We have a real hiring and retention issue. The only solutions right now require investment. We need a combination of increased salaries to ensure we are minimum competing with, if not exceeding, neighboring jurisdictions. Given the population that we serve as maximum and supermax facilities, and we need to pursue immediate stabilization plans for this staffing crisis. We need to bring back temporary hiring and retention incentives. In recent years, 2 officers in my local were stabbed in the throat and neck area, requiring them to be life-flighted to Morgantown for treatment. Another officer was stabbed in the face multiple times with a pen so badly she required medical care in Pittsburgh. Another officer was stabbed multiple times in the back and chest area. Another officer was stabbed in the arm. A new officer who was still pre-academy got his jaw broken, and many more attempted assaults with weapons, thankfully, that weren't successful. Something has to give. We can't go on like this. I'm asking you to provide any support you can with this budget to help us. We miss our families, we miss our loved ones, and we want to go home safely. Thank you.
I'm sorry, my name is Winton Johnson, and I'm MDOT Unit Vice President for ASME Council 3. I'm also President of Local 631 of ASME. We represent employees of the Metro Washington, D.C. region. For the last 22 years, I work at State Highway Administration as an FMT, which is a Facility Maintenance Tech. 5 years ago, we started seeing many of our shops lose positions. There are 3 reasons why people are leaving. One reason, many staffs don't feel valued as essential employees. We are plow drivers, we are maintenance crew, who you all rely on during the winter storms to get you here. This past January, our team worked 9 straight days to keep the roads clear, yet was only granted 1 emergency day through those 9 days. When you treat essential workers as expendable during a crisis, they leave. The second one is there are wage gaps between our neighboring counties. Maryland acts as a training ground. We provide the CDL training, and once the drivers get their license, they flee to Prince George County, Montgomery County, because the jurisdiction pays better. They have annual step increases, and the state refused to match. The third one, they're too much contracting out. They cut our pins to replace them for hiring contractors and of the work that we used to do. When I first started, the state employee was a gateway to the middle class. Now we're allowing it to become a stepping stone to a better job at county levels. Please support our state employees in the 2027 budget. Thank you.
Ready? My name is Lisa Thomas. I'm a member of ASME Local 227, and I serve as a maintenance supervisor at the Maryland Correctional Training Center at MCTC. I am testifying today to urge you to invest in our skilled trades positions. Currently, the state of Maryland is relying on a dwindling number of dedicated state employees to perform high-level technical work that would otherwise cost taxpayers millions in private contracts. My own work across 5 different facilities highlights these cost savings every day. Last year, I did a steam line repair in the road by myself. My cost was $60,000. The contractor's quote was $250,000. At Patuxent Institute, the doors needed to be fixed, and the contractors quoted me $360,000. I was able to get it done for less than a third of the cost for $111,000. In total, I saved the state alone $750,000 in jobs last year. Compared to state contractors' quotes, and that's just my one position. There are stories like mine in skilled trades positions all over the state. Beyond my technical work of welding and mechanics, I also lead a heavy equipment certification class. I am currently performing high-risk tree removals near power lines, a job contractors refuse to take. By training the incarcerated individual population to assist in the work, this single project is saving the state an additional $80,000. We are performing far beyond our job descriptions because we are short-staffed and the current pay scale is not sustainable. We are losing talent to the private sector daily. To keep our facilities running and our budget balanced, we must provide competitive raises for state tradespeople. Thank you for your time and for recognizing the value we bring to your state.
Good afternoon, Denise Gilmore, Legislative and Political Director with AFSCME Council 3. You have our written testimony. You've heard from our members. I just want to underscore how expensive it is not to invest in personnel. In FY25, state employees worked 6.7 million overtime hours, costing the state $350 million in overtime costs. Short staffing in agencies like the Office of the Public Defender, parole and probation, the Maryland Department of Health, within our Division of Rehabilitative Services in the MSDE, has caused high caseloads and waiting lists for services that cause more expenses on the back end than they would if we properly funded them on the front end. And as a result of the hiring freeze and position cuts, these vital services still have to happen. They just get contracted out, and they are often more costly and less effective, like you've heard today. Our members are more than just line items. They are on the front lines every day, and they are ensuring that Maryland runs. Anytime, every year, we go to the bargaining table, all we ask are for cost of living increases that keep up with inflation and annual step increases so that we can stay competitive with our peers who often see these types of increases. We ask you to reject further salary cuts that have been recommended by the Department of Legislative Services, and we ask you to reject position cuts. We simply can't afford them. Thank you.
Thanks, Chairman. First off, everyone, thank you for being here today. I had a question for you, Tony, real quick. And let me purposes, I'm on your side here. I represent an area that has 3 correctional facilities to the county just to the east of you. You mentioned earlier as far as losing pins. Do you mean as far as DBM actually reduce the amount of open available pins to hire, or are you losing people and you can't fill the pins? And if you don't know, maybe Denise can elaborate on it.
It's either DBM or the department is taking the pins from the regions.
Okay. So we're eliminating positions? Because my understanding has always been, I'm not on public safety anymore. I was when I was in the House. That has been the issue. I think these you referenced earlier. It's a lot of overtime because we can't fill the pins in general. And it's always baffled me why we just took a percentage of that overtime money, put in the salary increases to be able to hire more people. I don't know why we don't do that. Because we should, because the things that you face each and every day are obviously very challenging, and appreciate what you do. I would be interested on your perspective of the Second Chance Act, but that's a whole different conversation for another day in a different committee. But Denise, do you have anything to add to that, actually?
Yeah, so thank you, Senator, for the question. So we actually transferred pins out of the western region last year.
Okay.
And transferred them into the central region.
Is that right?
Yeah,
Okay.
and I would say, look, we're already short-staffed.
But there are still pins available in the Western area. We just can't fill them, though, correct?
Yeah, it's a combination of both.
Right. Okay, because it's one thing, obviously, if we can't fill them. I guess what I'm getting at, we're not in a position yet, though, in the Western area where we can't hire people because there aren't open pins. Like, there are still open pins, just maybe not as many as there were, but we can't fill even the ones that we have open. Is that
It's a combination
accurate?
of both, yeah.
Okay. All right. Thank you for the clarification, and thank you for what you do, sir.
Thank you.
Senator Stalling?
Thank you, Mr. Chair. I hear constantly in a lot of different departments, especially here, contracts or contractors. Your qualifications and the jobs that you're qualified for, certified for, whatever that's underneath you in your position. Are you telling us that they're taking away some of the job that you're qualified for and giving it to contractors and not using you? And to me, I would think in the long run, using contractors, they would cost more, and we would save using our own. Is that what you're saying?
Well, they use me. Okay. So like the steam line that I just read out loud, the steam line would have cost the state $300 and some thousand.
Right.
But they refuse to pay it, and they use me. I'm the one that gets down in the hole, and I'm the one that welds it. I don't see any of that money.
And in many ways, sorry, may I answer? Sorry. And I would say in many ways, I want to commend DPSCS for still having in-house maintenance. We see, for instance, I won't call this agency out, I certainly will if you want me to, but there's another agency that also operates 24/7 facilities that has moved away from having in-house maintenance, and so they're contracting out these functions as much. So where Lisa is saving DPSCS money, we're seeing another agency, for instance, with moving away from in-house maintenance as much, losing, like spending that money instead on contractors. It's a way that we think wasting money, right? Instead of just hiring.
I just want to make sure that the jobs that you're doing, that you're not just qualified or certified, but you're doing it in a safe manner. And if you're not doing that and you're not certified, if you're not qualified, you shouldn't be doing any other job. You should be doing the job that you're qualified for in every way, shape, or form. And I understand that being in the union for 31 years, that I was qualified as a heavy equipment operator, as a utility man, as a shipping and everything else. And I did those jobs. I didn't do anything else.
Right.
So if you're doing anything else above that, you know, I just kind of worried about that.
Well, and Lisa's being kind, but she's a supervisor, really. She should
actually
be
a supervisor,
supervising,
so-
right? Like, there should be folks under her who are doing this work in many ways, right?
Well, we can't compete against the wages out there for welders or steam welders.
Right.
So I'm still stuck in my old job.
No,
We have to be able to compete
yes,
to get the people to come in,
yeah.
and we're not doing that.
I appreciate what you do. It seems like you're going above and beyond the Call of Duty.
Far,
But,
far
yes.
exceeding.
I appreciate
yes.
that. Okay, thank you.
Senator, I'm piggyback off of for what you said. At SHA, like I said, I've been here for 22 years. They have outsourced all of our jobs, all of our work that we have been doing. As far as the works on the highways, they have given them to different contractors and saying that they're saving money because they don't have to pay them if they don't come to work. They don't have to pay them holiday pay or sick pay, but they're spending more money of outsourcing our job that we have been doing for numerous years. So what you're trying to say is, yes, they are taking our positions from us and giving it to contractors.
I appreciate that. Thank
Thank
you.
you.
Thank you for your testimony. Thank you.
Senator Bailey?
Thank you, Mr. Chair. Following up with State Highway, and you made reference in your testimony talking about essential employees and dealing with the snowcrete that we just dealt with for 9 days. And I've talked to people that work for there, and their sentiment has all been the same. Next time it gets cold and we have this, we just use and leave. And we're not coming in anymore if we're not getting paid for what we did. And we saw the results, especially anybody that drove down 301, there by the Bay Sox Stadium, where 10 days after we were still down to 1 lane. And traffic was just a nightmare. If you could just go into that and tell me, what do you mean by the essential pay, and what was the issue, and why did people start calling out from work and not go to work?
Because that is my area that you're speaking of. I hate to say it, but basically, the state utilize, SHA utilize different titles for us every time it's an event, right? This event, they wasn't planned, wasn't ready for the equipment. We didn't have the proper equipment. The shop that you're speaking of have more than half of their equipment down, which means trucks to plow. That's why you're so backed up down there, right? Out of 33, they had 17 trucks down. They had 3 or 4 people riding in the truck together instead of trying to find some other way how to go about doing it and getting vehicles fixed prior to it. So that's what I mean by they wasn't prepared for the event, right? And up to the day, it's still the same. They don't have the proper equipment. That's why we had to come back out with the front end loaders, and it took us such a long period of time because of the ice froze up, and we had to come back with the front end loaders. That's why it took us so long, the 9 days, and like you said, 10 days. But when it comes to essential employee, they consider us essential employees, but we're not being paid as essential employees. They keep us out 24/7 until the roads, you can see the white line and the yellow lines, and working constantly, and the employees are getting really fed up because they're not getting their worth. So that's what they want to be. They want to be made whole, and they want to be able to get paid the way that our counties and municipalities getting paid, because we get paid less than county municipalities.
May I, Mr. Chair, if I may? I mean, look, the private sector's figured this out. The reason that you have emergency pay for emergency conditions like this is to incentivize workers to come into work. And it's not, look, it's not, I've also, dealt, it's obviously our state highways, but it's also our 24/7 facilities. It's our first responders who are, our state troopers, right? Like everybody in state government who has to respond in the worst of these storms. It is incentive, it's a recognition that you are leaving your families, you're going out in the height of a storm to do things where the rest of us are, able to sit comfortably at home during these things, that you are going above and beyond during, you offer an incentive, an extra pay, right, to help do it. And unfortunately, the way that the incentive for the state works is you have to both have a state of emergency and declared state closure. Oftentimes, that only occurs during Monday through Friday, 9 to 5. Different administrations have interpreted that differently. Some administrations have carried that closure to cover weekends and the evening shift and night shift in recognition that there are first responders that still respond during storms in off hours. Other administrations haven't. I think it's a policy choice, but I think, certainly in recognition of the folks that are responding in off hours, it's a way to recognize those people that still have to go. And it's a way to staff the state and our first response during it. It's an incentive to get people to show to work. It's certainly not uncommon in like the private sector if you're trying to staff a hospital, for instance. Thank you for the question.
Thank you. Any other questions, this panel? Thank you all very much. We have a few more witnesses. Ms. Williams, Ms. Segev, Ms. Roberts, and Ms. Caudio.
Is that Kennedy?
Anybody here?
Is that Quadio?
Quadio, yes.
Yes, that would be me.
My apologies. Come on up. My apologies for the pronunciation.
It's actually Kennedy Quadio. The Kennedy is important because I'm a Scottish Kennedy.
All
and
right.
nobody beats Scottish Kennedys when it comes to money. We want to get what we paid for. Where's the other people? Am I the only person? Oh, okay. I'm Michelle Kennedy Quadio, Vice President of A Mother's Cry. And this year I was appointed by Jamesina Green, our president, as the strategist because I know money. I worked international trade finance for over 30 years. I was trained in results-oriented management by objectives. I'm a women's executive leadership graduate. Doesn't matter whether I'm a man or woman, I'm thinking money. When I looked at the budget this past year, both on the capital improvement and also on the operational budget, I thought, wow, we need to re-engineer this whole thing. Because I would tell you what I didn't see in this budget. My son has been in prison ECI for the last 10 years, the worst nightmare a mother could ever imagine. So when I look at how our monies are being spent, I'm looking at the results of, are these people living? So now, as you know, we've had increase of deaths, even since the end of 2025, 25%. The secretary will tell you that it's increased, population that are coming into the prisons. Well, 53% are serving years, life sentences, 25%, 50% includes the life sentences, 50% is over 30 years sentencing. Maryland cannot afford this. When I looked at the budget, and I thought looking at the capital improvement budget, I saw nothing for improvement of state facilities, 14 state facilities that are aging. I gave 2 interviews in 2024 and 2025 about the need for air conditioning. I suggested we rent air conditioners to be put in the common areas during the hot seasons, which would be May to September. We wrote to the governor on this twice. We have supported the union. Okay, we supported the union because right now what I would ask is we've got 2,500 correctional officers short. Every year when we have 500 pins, some of them are diverted to administration. We can't do that. We need to be more creative between the leadership and personnel and recruiting. I would suggest that for the western and eastern regions that we increase or use some kind of additional incentives to recruit and retain, and also that we start reporting against the 2,500. If I have 500 pins and I hire 200, but 200 are have left for retirement reasons or for other reasons because they can't work in those unsustainable conditions, then I would say we look at it. Finally, what I'm going to ask is that we have a study, because it's going to require more than these testimonies to look at a budget that actually works for Marylanders and doesn't result in dust in custody lawsuits that are mounting. Thank you for your time.
Thank you very much.
You're
Members of the
welcome.
Committee, any questions? Thank you very much.
You're welcome. Thank
That
you.
concludes the hearing on this budget, and we're now going to switch over to a bill hearing. 5 minutes. 5 minutes. Yeah, 5 minutes.